Hello everyone and welcome to our AIS Facebook platform again to discuss one another subject today related to our practice. So as we know in our clinical practice we try to use various kind of clinical diagnostic tools to assess our client for their imbalances, at what level those imbalances are, and what is happening, whether they are related with the psychosomatic disorders or on a physical channels imbalances. So all that part, Ayurvedic practitioner, at whatever level you are practicing, you will try to assess. And even we go to a medical doctor or a specialist, they will try to use their different tools. If you are going to a GP, he or she might check your blood pressure, and then they might try to look at some other aspect. It's an unfortunate situation since COVID, and I'm sure many of you must have observed that if you have visited your GP in the recent last 2-3 years time, that nowadays they don't even look at you, and they all on their screens, and even their face is now towards their laptop or the big computer screens, and that's how they keep putting your information and all that part. So that's something is a little bit means sad, but because our main Western medicine is in a main stream of medical science where everyone has to go, whether you have a simple hay fever or you are getting more serious problem. But yes, when you are going with a specialist based on your problems, they will do some procedure, whether it is colonoscopy to be done for your ulcerative colitis or other issues, or if you have some issues happening in your upper abdominal area, endoscopy will be done. Then you have some eyes issue, eye specialist will use their instrument. So, and then general blood test and more detailed blood test, whether they are assessing your CRP or ESR or white blood cells or blood platelets issue. So all those parts will be done by them. But with an Ayurvedic practitioner, their main tool of diagnosis is one of the prime one is our Nadi Pariksha, what we call as pulse examination. Now in pulse examination, again, there are so many aspects what every practitioner has to learn, and it all depending upon the teacher who is giving them the information that what exactly they are teaching. Yes, pulse examination, we nowadays can go on even on social media and know that we are using our 3 fingers, we are using our pulse to pick up the radial pulse we are trying to pick up, but and then we will say, oh yes, it is Vata, Pitta and Kapha. But what exactly we learn in that, that is where the whole aspect comes up. By just closing your eyes and then assessing your pulse, and then many will be doing those 3 fingers and putting on the pulse of the client in a way that whether client is standing or sitting, what difference it makes. If you're not able to have that answer, it means you don't know the principle. Now many places you will see the pulse is done that where the client is sitting like that and their pulse is this way, and then the client practitioner is putting why that is right or why that is wrong. If that answer is not coming to a practitioner, you will be in trouble one day. And when I say trouble means because this is where the aspect of our consciousness comes up. Whenever we are practicing, yes, your client, your customer is not competent to identify what you are doing is right or wrong. But you know intuitively what you are doing, is it right or wrong. Even when you are in your classes where you go for learning and try to learn all these skills, if you're not able to really find the answers for your all questions, that what exactly you are picking up. If you have been given, say, that you have to pick up Gati, you have to pick up Bala, you have to pick up the Akruti and all that aspect. Now, even the Tatman is one thing which is in the Nadi Pariksha people have to assess. But if you don't know how to discount the body temperature before you go to the pulse temperature, what exactly you are doing? It means we are making ourselves fool. Here again, my point is not to get into a criticism, but my point is coming up, as I mentioned many times now, that there are two reasons for me coming for these discussions or talk. One is that Ayurveda in this part of the world is now becoming more and more serious modality among public. They are looking towards Ayurveda now as a serious modality because of their disappointment from other sciences and other modalities, other professions. They have seen that they are not just using Ayurveda now to get an Ayurvedic massage or Katibasti or Shirodhara. That is not the association of majority of the people is now. They really go to an Ayurvedic practitioner for serious ailment. And in the serious ailment, you have to use your skill, what you are learning or what you have learned in your clinic, in your colleges through your studies about clinical diagnosis skill and implement them. And again, as we always talk about, that these information, what you gather, you have to analyze together that what exactly the findings are coming up. So pulse examination is one of the major tool, but one of the major tool with the complications also, because it is everything what you are trying to perceive is in a subjective understanding, and that depending upon your state of mind and how focused you are. But by just closing our eyes does not bring any focus. We all know that whether it is in the clinical diagnosis procedure or you are trying to do your meditation, and that's what I always have shared, that when you are doing meditation, and many of the students will say that I am doing meditation for last 20 years before coming to learn an Ayurveda, then how come your anger, your frustration, your panic attack, your anxieties are with you? So it is in a pure contraindicator statements which we all need to sit back. And that's where the problems come up. Again, in the same way I have mentioned about all the time in the yoga therapies also, reason of bringing these things again is because they all connected. Coming back to our main focus, not to drift away too much. So when we are doing the pulse examination gives us so much in-depth information, but we need to understand how to gather that information. But to start gathering that information, there are certain basics which your teacher must teach you. That even simple, why your nail should be cut. If you have never been asked about that, go and ask your teacher. Then if you are straight away putting your hand on the wrist of your client and start gathering or start listening and pretending that I'm gathering information, what is happening? If someone has not told you that what should be the temperature of your hand and then what should be the temperature of your client's wrist, go and ask your teacher. In the same way, if you are trying to now gather the information, why you are using your index finger as information to collect for the Vata intelligence. What is the reason there? Same way, why your ring finger is used for Kapha information. And then interpretations are the key factors for us to look at. So, question here is, if I keep doing my pulse examination and I know intuitively inside that I am not able to pick up anything, or even if I'm able to pick up, yes, I can pick up the bala is very strong, then what does that mean? At what level you have picked up and what it will interpret? And these things, if you are not able to answer and trying to pretend now or trying to just make some your own observation, it will keep adding layer by layer on your conscious, and that is where our own psychosomatic disorders start happening. And I'm sure you are not doing the practice just to add more problem to you. So that's one thing you always must go, not just learning and yes, quickly putting in your 3 fingers on the wrist of your other co-fellows. Ask all these questions. Why should not do pulse examination standing? Why I should not do pulse examination having the wrist of the client above the head or all that part? Why I should not cross the energy field by my 3 fingers? What sort of pressure I need to look at? How many times I need to do the feeling of the pulse before I start taking the reading? And what exactly these readings mean, from where they are coming, right? How I distinguish from the physical to the emotional level, psychosomatic levels. So those all things are in the pulse examination. And what happens if the right hand pulse is not correlating with the left hand? What is the reason? All these explanations should be asked from your teacher. And first of all, if teacher has not given you that information, he or she need to ask themselves. That's not my area to talk about. Then comes the second diagnostic aspect. We look at the tongue examination. We ask the client to poke our tongue and then try to look at the different channels, different organs, what is happening there, right? But we need to understand it's not just the covering on the tongue which will be indicative to you. So there must be different other aspects which you should learn effectively, right? Say, for example, if your tip of the tongue is red, now just to say that client is angry or client is in a pitta aggravated does not mean anything. There may be many reasons behind that. And then if you have to assess what is the CRP, what is the ESR, where you're going to look at in the tongue, that you should know which channel I need to assess to identify that part. If you are going to look at that, yes, my client's PSA might be a bit higher, which area of the tongue you are going to assess. So you should be very clear on those aspects. You should be very clear which side of the tongue gives me the Raktavashrota's liver organ and the Raktavashrota's spleen organ. And that diagnosis, if you are not able to make, then it means you are feeling a little bit uncomfortable. And uncomfortable is not what you should be feeling ever. You should, with the passage of time, should be feeling more and more confident. And that confidence only will come if you have learned effectively. So you need to sit back rather than just trying to get yourself ready to receive a piece of paper, that whether all these skills I am getting confidently. If answer is yes, that's perfectly good. If answer is somehow not good, because yes, your mind will give you the answer, yes, 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 it's all good. But deep conscious is where it will give you the real. That is what the difference in man and chit. We always talk about in Ayurvedic psychology, what is the difference between man and chit. Chit is your pure consciousness. It will never give you false information. You will intuitively able to identify that what is going inside and what's going wrong and what I have done, whether it is right or wrong. So those layers are very difficult to wash, but that's where you are in a position, you have the ability and capability to mitigate all that part, but only if your learnings are coming in a correct way. And then another diagnostic tool what we do is eye examination. And eye examinations are at two different levels, that you look at the eyes and you look at the sclera and all these vessels to assess the lower side of your sclera, lateral part of the sclera, upper sclera, what that mean to us, and how to assess those vessels, that which one is coming from the Manovaha levels, what impact is happening there, all those need to be assessed. Even in those aspects you can pick up that whether it is the impact of anger or whether it is the impact of the panic attack. Those aspects in the vessels can be picked up if you are really serious in your learning. And if that has not been talked about, you need to look at why that is not the case. In the same way, in eye examination, there is one of the most effective tool is what we call as Ayurvedic iridology. Now, Ayurvedic iridology is something which has not been taught in various Ayurvedic colleges, schools, or by different teachers, because that information is not very comprehensively put together in our ancient text, but information is there. So that information has been collected by me, and we teach at AIS in a very effective way. And Ayurvedic iridology actually able to give you very detailed information about majority of the problems nowadays which are happening, what we call as our psychosomatic disorders, our mental and emotional issues. Yes, physical aspect you can pick up, that your blood test reports can give you an idea, your colonoscopy can give you the understanding that yes, ulcers are happening. If the ESR is high, then you know that chronic inflammations are happening and all that part. So those aspects are there. But then what you won't be able to pick up with any of the tool is the impact of psychosomatic disorders. That is where Ayurvedic iridology very clearly, when I say clearly, because this is not subjective understanding, it is very clear objective understanding and diagnosis which you can pick up and then learn the skill that how to interpret. And that is again, you don't need to interpret by closing your eyes. You can interpret by keep looking at the charts, what you have, what you get when you are learning these things and how to assess them. Then you are able to assess the state of all the 7 chakras. Again, as I have mentioned many times, that when we talk about these 7 chakras, many of us feel, oh, this is just something hairy-fairy. Again, the problem is whenever something you can't see, people start questioning that. That is where your intelligence or intellect comes up. And you always want to question, because something you can't feel or see, you will be making a question mark. But that is where your that experience of putting your learning into action comes up. And 7 chakras, again, I hope those who associated with yoga, they must have heard this part of 7 chakras, Kundalini, awakening of Kundalini, and all that aspects comes up. But these 7 chakras marker how you can assess on an objective level. That is where your Ayurvedic iridology helps you to identify. So these are the 2 major points of difference in Ayurvedic iridology, which through the eye examination can give you a distinguished finding, which then you can correlate if you are skilled for pulse examination and the tongue examination. Then the face examination is another aspect, that how you can assess physical imbalances in various channels, and then emotional and mental imbalances can also be picked up from your face examination. So all those considerations are very much reflective in Ayurvedic clinical diagnosis skill, which all our students learn. And that's where the part comes up, that your learning is something which you should always put it into practice and keep assessing and keep doing that. You should be living and eating all the time your learning if you are an Ayurvedic student. Ayurvedic studies never finish, and that's where the point of difference is in Ayurveda and any other modality. Even though in other modalities I won't say that yes, it finished, and everyone knows that with every day or every procedure, if someone is a surgeon and if they have doing the heart surgery or gut surgery, every surgery give them a lot of new experience to learn what sort of. Nowadays it has become so much sophisticated, you don't need to have a bigger cuts. Nowadays technologies and cameras help you to look, but still every day those surgeons learn so much new ways and new aspect which they keep adding to their knowledge. And from Ayurvedic perspective, because majority of this all learning is all about your experience and then implementing those experiences in our life so that our life can also enhance. That is the point of difference in Ayurvedic experiences. Whatever we learn, it also enhances my learning, whether it is my Ayurvedic nutrition, whether it's my Ayurvedic pathology, or whether it is the learning of Ayurvedic pharmacology. So everything I learn and then know that what benefit of this thing can come to me at a first level. So that's where I thought that I should share with you that these aspects of not only the clinical diagnosis, which I just picked up today as a part, that how we should learn effectively, and if you already have learned and you are a graduate, making sure that your learning is correct, and that you can only identify implementing these tools in your practice, but not just doing it and not cross-checking. Try to evaluate your learnings with the finding what your client already have, or even if not, because some of the information through whether you are doing Ayurvedic radiology or pulse examination or other tools, you can pick up beforehand, and that's what you can always assess that what is going on, whether that information was correct or not. So that's the part I will say you should always look at, and but then each of these tools has certain guidelines. So guideline is where my focus was today, that you must get those guidelines correct from your teacher. That's what the role of the teacher is, to give you all the basics very clear. And if the basics are not being followed, ultimately we are going to make mistakes. Hence, never miss the basics. Try to learn, and if those has not been explained clearly, try to have a discussion with your teacher so that you can gather all that and understand that yes, what difference it is making now. So that will help. So on that basis, I think that's something for you to sit back and listen and think that what point of difference comes up through AIS learning and with the others, right? We just in a process of closing our enrollment for March 25. We have a very good interest this time from student, but as I said, that interest in Ayurveda is growing at every level, to learn also as well as from the client perspective. And that client perspective is reflecting straight away in the learning part too, that yes, those people who are interested to make some career path changes, they also now very confidently able to see that interest in Ayurveda is growing. So it means it can help me to have a stable practice, because that is one question mark always get asked by student, that what I can do, whether it is going to help me to have a stable career path, can I make my earnings, and all that questions always keep coming. Because yes, no matter how much you are disjointed from your current job or current profession, if you don't feel confident that yes, whatever next I'm trying to get into will give me stable income, we always feel hesitant, no question in that. But then at the same time, everyone need to look at your inner peace. If you are happy with something, if you are happy by making a change in someone's life, if you are happy that you have contributed towards the well-being of someone, that kind of satisfaction is beyond any comparison with the monetary gain or like that. But still saying so, we all need to definitely have a stable income, and that's what I can assure you. Now Ayurveda is at that stage that all of us, if we have a good skill and learn and practice with good intent and focus, we able to make our earnings to that level that you can satisfy yourself, you can also support your family. So that's all from my side. Thanks everyone. We'll catch up next time.